What are environmental triggers for addiction? Imagine walking into a room and suddenly feeling a strong urge to reach for something you know isn't good for you. That's what environmental triggers can do. They are parts of your surroundings that can push you toward substance use or make recovery harder. These triggers are not about genetics or biology but about what you see, hear, or experience daily. They can influence your choices and sometimes lead to relapse if you're in recovery. Understanding these triggers can help you stay on the right path and avoid situations that might tempt you to use again. Think about your family environment. Growing up in a home where alcohol or drugs are common can increase your chances of developing a substance use disorder. If there is a lot of stress, conflict, or instability at home, it can also make you more vulnerable. Children exposed to parental substance use, domestic violence, neglect, or abuse are more likely to face similar issues later. When there is no steady support system or caring adults around, young people might turn to substances as a way to cope. Your friends and social circles matter a lot too. If your friends use drugs or alcohol and encourage you to join in, it becomes easier to try substances yourself. Peer pressure is especially strong during teenage years when fitting in feels more important than anything else. Being around people who normalize or glamorize substance use can make it seem less risky. The neighborhood you live in can also be a big factor. Areas with high crime rates or poverty often have more easy access to drugs and alcohol. If stores or social events make substances readily available, it lowers the barriers to use. When recreational activities are limited, people might turn to substances for entertainment or relief. Cultural attitudes toward substance use influence behavior too. In some cultures, drinking alcohol or using certain drugs is seen as normal or even expected. Media messages and societal norms can make experimenting seem harmless or glamorous. This can lead to more regular use or even addiction over time. Chronic stress from work, family issues, or community violence can push people toward substances as a way to manage feelings. Trauma, like physical or sexual abuse, can also increase the risk of substance use disorders later in life. Stress and trauma can change how the brain responds, making addiction more likely. Limited access to health care or mental health services can make it harder for someone to get help early. Without support, substance use problems can grow worse and harder to treat. Recognizing these environmental triggers helps in prevention and recovery. Avoiding risky environments, building supportive relationships, and creating healthier communities are all steps to reduce the chance of falling into addiction. Knowing what surrounds you can make a big difference in understanding why some people are more at risk than others.